KFUG Community Radio. Time now for this week's Health Matters with PA Lynn Szabo. Lynn, how you doing today?
I'm doing great. This is such good news.
What's good news?
Vaccines for kids.
What?
Yep.
Now, when I was a kid, I did not take that as good news, but okay, so we have an email.
Really?
Lynn sends an email every week just about what each Health Matters is going to be, and you started this out just like you're just trying to talk these kids into getting shots. Exciting news for ages.
I'm of good news here.
So it's not just any shot. We're talking about COVID vaccines and vaccinations for kids as young as what?
Age 5 to 11.
Whoa.
And
You can
it's
get that
their turn to
vaccine
get protected. And actually, my kids always like their shots.
Really?
Yeah.
Did you administer them?
Sometimes they asked for that. Yeah. Although
that's cool.
The MAs give a lot more shots to kids,
Oh.
but yeah, sometimes they ask for that.
I was scarred as a child. My aunt said one day she was watching me. I was a little kid, and she was going to take my little cousin. We're going to go he's got to get an inoculation. And then we got there, and then she slipped in, and a flu shot for Paul. And I've just been off back. I'm just, because they come with lies. But
Yeah, well, we use terminology that most kids don't understand. Are you ready for the procedure? Do you need your inoculation?
All right,
Anyway.
so this is something that's been, of course, months, a year coming as
This is so good.
and this is let's jump in. So we're talking 5 to 11.
Yep. And the first thing is why? Why do they need to get it?
Well,
kids get COVID. They spread COVID, and some of them get very sick with COVID, and a lot of them get long COVID. A lot of them are long haulers.
How do kid COVID numbers? I know there's a better way to say that, but how does that compare with adults? As far as just I don't know, percentage of how less likely or are children to contract COVID compared to adults? I've just never seen that.
I think they're more likely to get it, but they're the thought is that they don't get as sick. But that's
Gotcha.
not always true.
Yeah,
a lot of
yeah.
kids are not. But if you think about it, they're actually probably the highest risk group right now in the community because they go to school.
Yeah, exactly.
Yeah.
Yeah.
So, and they can also have long-term consequences, and we don't even know those long-term consequences. I know from what I've heard from Dr. Alsbury in Houston, where she's doing her fellowship on, surgical OB, so learning how to do C-sections. She said the moms that get COVID there deliver early, and their babies are, she calls them punky. They're not really
What's that mean?
robust. They're not growing well. They're not nursing well.
Oh my
And
gosh.
so she's concerned about the long-term consequences of that. But this is for kids ages 5 to 11. And there are kids in our community that have underlying medical conditions that make them more at risk for serious disease. And some of those conditions are things like asthma. So pretty common. So you're not only just worried about kids perhaps have bad immune systems or bad immune function because they're undergoing treatment for leukemia or something. It's way more common than that. It can be asthma, which is super common here because of cigarette smoking sometimes. And, it can be other things too. Vaccinating kids also keeps them in school and keeps them in activities like sports and group play. So that's how we grow tiny humans into, humans with the most potential.
Functional adults.
Yeah, exactly. But is vaccinating children and teens safe? Oh, it totally is.
Okay, good. And you're saying that as a scientist.
I am.
It totally is.
I am. Actually, there are millions of people that have gotten, especially the messenger RNA shots by now. And I was just actually reading an article that we might talk about in more detail next week, but looking at all-cause mortality except COVID. So it's not really all-cause mortality, but it's mortality, comparing mortality levels in people who are immunized and non-immunized during kind of the same period in time. And they looked at a diverse population of ethnicities and also diverse age group. And what they found is that people who are not immunized for COVID are dying from other things, non-COVID related. But the same is with kids. So it's a super safe shot. the benefits outweigh the risks. That's kind of how we make decisions in life, whether we recognize that or not.
And let's be clear. I mean, because everybody goes, oh, well, somebody, especially I see the word myocarditis coming up.
Yeah.
But everybody you're talking about, oh, well, there are risks. It's overwhelmingly safe. Right? The kind of risks we're talking about are no different than risks with any other vaccine, correct?
Right. Overwhelmingly safe, despite what people think the data on VAERS is. So VAERS is the vaccine adverse effect reporting
Yeah, but that's
system.
like Wikipedia. Anybody can go with
Right.
that, right?
You can throw anything up there. And, they sort through it looking for trends. They don't pay special attention to every single thing that's put up there. Okay.
So, Lynn, I have a question about the myocarditis thing.
Yeah.
Because I know that IV drug users can also be susceptible to myocarditis as well.
They get endocarditis.
Endocarditis. I'm sorry.
Slightly
That was
different-
that's
slightly
where I'm
different thing.
confused. Yeah.
Yeah.
Because I was wondering whether it was the actual drug or the injection practices that were causing it, but two different things.
No, two different things. Endocarditis isn't a thing here, but myocarditis and pericarditis are medical terms for an inflammation of the heart muscle. And if somebody has a concern about myocarditis or pericarditis and they don't want their kid to get the shot because of that, they are completely overlooking the much greater risk that COVID can cause. It does cause myocarditis and pericarditis in a more severe way, and also, a less treatable way. So if your goal is to decrease your kid's risk of myocarditis and pericarditis, then the immunization makes sense. So what they're seeing.
Now, I want to rephrase. I want to say that again.
Yeah,
right.
that's
Because people
really
are talking. That's very important. It's that you have, because I've seen specifically myocarditis. Foisted up, brought up is like, this is
Right.
why I'm not getting vaccine or not having my kids get vaccines. You have a greater risk of a worse condition.
Right.
By not getting vaccinated. If you get
Right.
COVID, it could be much worse, and you have a greater statistical risk of developing something like myocarditis because of COVID, as opposed to developing it because of the vaccine.
Yeah, actually.
Okay. I wanted to
I would
say that
agree with
consciously out there.
Yeah, so if your goal is to reduce your kid's risk of these two concerns, then get your kid immunized. It's a no-brainer.
Yeah. Well, I just like the fact that, when people are trying to sound scientific online or whatever and say, well, you've got this risk of this, it's nice to know, well, yeah, you've got a greater risk of a worse version of that same situation by not being vaccinated. And that's a good thing for people to arm themselves with, I guess.
Yeah, absolutely. This virus does so many different horrible things to people. We're just sorting it out right now. And the risk to the health is greater with the disease by far.
Yeah.
So myocarditis from the vaccine is usually mild and self-limiting and is pretty easy to treat.
Okay.
So not so much a big deal. Not the cause of something that would keep somebody maybe from being able to play sports in the long run. Say a teenager who was super good at, or a preteen who was super good at playing soccer.
Right.
How's this going to affect their soccer career? Getting the disease is going to have the more negative effect. And they're seeing that kind of surprisingly in college athletes and stuff, but we digress.
Okay.
So it's way safer to get the shot, is the bottom line. The risk of allergic reaction is very, very rare. People oftentimes confuse a good immune response with an allergic reaction or what they call a side effect of the vaccine. I suppose maybe a healthcare provider could explain it in more detail. So if you had those concerns, you could talk to your provider directly.
And again, just quickly and as an aside, it's wrong to think of that response of those, maybe a couple of days of feeling under the weather after the vaccination. It's wrong to think of that as a side effect, correct?
Yeah,
That's
how I
the
see
effect.
it.
That's
Although
what it's supposed to do.
It's commonly used terminology, but I always call it a good immune response.
Right.
With a little cheery lilt in my voice, That's a good immune response, But I'll tell you, as providers,
Mary Poppins in
There's
here.
the
What's going
bee's
on?
knees of immune responses.
but I'll tell you, as providers, when we all went through that, so they vaccinated us on Fridays so we wouldn't call in sick from our good immune response. But we were actually all pretty stoked about it.
What, stoked about what? About getting that immune response?
About getting a little bit of fatigue, or getting a low grade fever, or having a headache, or some of us got enlarged lymph nodes, and we're all like, oh, message received from the immune system.
Nice.
Touchdown.
Everyone knew you'd be back to work by Monday.
By
Yeah,
Monday,
right.
because it's self-limiting and not that big a deal. For me, for my third jab, I just looked at it as an excuse to take a lot of naps.
That's nice. So that's also a question I have, because I'm thinking it's time for booster shots, and for me to think about that. What can you expect as far as that, not side effect, but that immune response, that wonderful immune response?
Well,
That
if
makes you
you're-
whistle.
In your case, as an adult getting your third jab, it's probably going to be similar to the second jab.
Oh, wow. So,
And
yeah.
My
yeah.
personal experience was I was just tired.
Yeah.
And my second jab, I had fevers and pain at my arm and stuff. But my third jab was just all about the nap.
Okay. And same duration as the other.
Maybe a little less.
Okay. Yeah. All right.
So COVID vaccines do not cause fertility problems. Can we say that again?
Yes, COVID vaccines do not cause fertility problems. Was it Aaron Rodgers? Who was it?
It was Aaron Rodgers, and it's just a whole big debacle that's blown up in the fact that he actually he tried to lie when he was
Right.
asked whether he was vaccinated.
Yeah,
he says,
sure.
"I've been immunized," is what he said. So, and that's a digression, but he really kind of showed his whole posterior on this one.
Right. And so again, COVID vaccines do not cause any fertility problems.
Yeah. I'm not sure where that came from because it was so not data driven. Probably
Right,
our
well.
friends at Facebook.
It's meta.
So-
It's meta now.
Yeah.
Startled
So
and making people
the
say
vaccine
things
that's
they don't know
available. Sorry.
about. I was being a little stinker.
The vaccine that's available for ages 5 to 11 is the Pfizer vaccine, the messenger RNA Pfizer. The dosing for children is lower than the dosing for adults. So, and the first dose, you get the first dose, and then the second dose 3 weeks later, plus or minus, and the maximal immunity is considered to be at 2 weeks after the second shot,
Right on.
for what we know in time. I mean, that'll probably change over time.
Are these fully licensed now, fully authorized for use, or are they under that emergency youth
I think
authorization?
they're still
that
under
first took
the
place?
emergency.
I'm sorry.
I think they're still under the emergency authorization. That doesn't mean that we don't know what we're doing here.
Right,
So,
right. I guess what I'm kind of getting at is that people will use the fact that they're not fully authorized when it comes to those who are fighting against the various mandates. They'll say
Right.
it's not fully authorized.
Yeah, and that's unfortunate because, for example, monoclonal antibodies also not fully authorized, and you can't use it on kids. So if somebody's personal hope in not getting vaccinated was that they could always be treated with monoclonal antibodies, you can't really have that same hope with kids.
And it's not fully authorized either.
No, but yeah, you can't really pick and choose. So what can you look for as a good immune response, and how as a parent can you manage that? These are all pretty mild. So mild pain at the site of the injection. They're usually in the arms, but the nurses are also, in the younger kids, might be giving them in the lateral thighs. So that means the thigh that's on the outside of the leg. Tiredness, headache, muscle pain, chills, fever, and nausea. Although I haven't seen too many people with nausea.
That was part of my response.
That
Was I
was?
had just a little bit of a stomach. It wasn't. I wouldn't
bit
even
of
call it
an
nausea, but it was approaching nausea. Yeah, queasy, a little queasiness.
Yeah.
I know one person who got so sick that was like the most sick they've ever been in their whole life.
Just what, nauseated?
Like actually sick.
Uh-huh.
Fever, chills, like throwing up, the whole deal. And he said it was the most sick he's ever been, and he hated it.
And that
The
was just
whole
from the
feast.
vaccine. Wow.
And it was just one day
So he's like immune forever now, right? Because he
That's quite an immune response.
that's a
but
burly
only
burly
one
immune
day,
response.
and you can point out that probably a lot as unfun as that sounded, probably better than being on a vent.
Right.
Just saying.
Yeah.
So, but all these signs are signs of good immune response. They're all easily treated with anti-inflammatories and Tylenol, and they're all short in duration, usually a day to a day and a half. There is a program called a V-Safe, V as in victory, SAFE, S-A-F-E, which is a smartphone confidential tool to get text message support after immunization. So if somebody wants, is still a little nervous and feels like, the weekend's coming on and their doctor's not going to be available, this is a place they could get support.
Support for what?
So for how to manage a good immune response.
Gotcha. Okay.
Because parents don't like seeing their kids with fevers.
Uh-huh.
They really don't like it.
Uh-huh.
And so how much do you allow? When do you treat? When should you be worried? When should you be trying to, seek direct health care because of an immune response that's scaring you?
Okay.
Okay. So insider tips, okay? No need to medicate with Tylenol or ibuprofen unless you have your child has a specific condition.
You mean pre-medicate before immunization?
Oftentimes moms will give kids Tylenol before they get around to shots.
Mm-hmm.
There's no need to do that here, and they're trying to discourage it. I'm not really sure why. But if I had a kid who maybe had a history of febrile seizure,
That might be a good thing to do, right?
secondary to shots, I would definitely bring that up and talking to my healthcare provider.
Right.
And consider pre-medicating.
But just as a prophylactic device as far as they go, you're going to be
you don't
sore,
really
here,
need
take this.
it.
Yeah, okay.
Yeah, you don't really need it. You can definitely use it if a problem develops,
Mm-hmm,
but don't need to pre-medicate. And this is so cool, you can get your child's flu shot at the same time.
Right on.
Yeah.
Twinsies.
I think Lisa and I are going to try to do that this week. We're going to try to get boosted and flu shots.
That'd be great.
Get boosted, get flued.
Yeah, it doesn't quite translate, but yeah, it's a good thing to do, and it's the time of the year, and I'm a week late, so I wanted to do this before Thanksgiving or before Halloween, like your advice always, and I always forget. So, but so far no flu, so we'll
Okay,
go get that.
Good. You're paying attention now. That's good. So where can I get my kid vaccinated? So all the nurses in this whole county are Twitter about this vaccine. They're all writing procedure manuals. They're all trying to think of ways to have maximal amount of vaccine and how to get people in the clinic to get it done.
Really?
Yeah. and
Big
there's-
deal, huh? Super stoked about this. That's
yeah,
great.
and there's actually a lot of parental interest in it.
Mm-hmm.
So, so in Del Norte, all of the community clinics are gearing up to immunize kids from ages 5 to 11. I imagine I'll start next week. Call your clinic for times and procedures. But I know at UIHS we're all about shots and arms. So walk-in patients. My guess is immunization nurses, but they would really be accommodated. And then, our secret site at Elk Valley.
That's right.
Nurse Shammy.
Nurse Shammy tucked back in the woods over here.
Right, over by the tribal head start on Norris Avenue. So Shammy does pop-up vaccine clinics, and she sits in her van sometimes at Smith River, sometimes at Elk Valley, sometimes in Klamath. And it's super easy just to walk up, get the shot, be done in 15 minutes, and she gives good shot.
Nice. That's good. Yeah.
She does.
That's great.
Yeah,
I'd like
really
to-
nice
quality.
lady, very knowledgeable.
I'd like to interview her sometime. Just I have this. It's like a Johnny Appleseed kind of thing. Just in Del Norte with the shot. Here I am.
Yeah.
Have syringe. We'll travel kind of thing. You know?
Yeah, she's an unsung hero in this community. Actually, COVID warrior princess.
Right on. Thank you, Shammy.
Nurse Shammy. So, but call your clinic for times and procedures, and don't be surprised if you can also get it in the pharmacies. Pharmacies are probably happy to provide it too.
So is that? Okay. So let's run down for me, because you say all the clinics. Well, yeah, we've got time for this. All the clinics, and so what clinics are we talking about? We've got Open Door.
Yeah.
What's happening with Sutter? Are they still like? I know that there was talk about changing and doing things with Sutter, and Sutter is going to be undergoing a move and a new.
Right, yeah, the walk-in
Stalin
clinic,
and all that
I
stuff.
think, is moving behind the hospital, and Stalin is taking over the walk-in clinic.
But that has yet to occur, right? So
That's going to happen in January.
Okay.
And they don't talk about vaccines. They do adult medicine.
okay, so is that
So,
not an option for vaccinations? I'm trying to list the places that are just all the clinics in the county. What are those clinics?
Right. I don't think they would vaccinate for kids. They probably vaccinate for adults.
Okay.
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 And then SCCC, so Sutter Coast Community Clinic, so AKA behind the hospital, has a peds practice, and they get vaccines for children. So my guess is that they're going to immunize. UHS is like all over it, and Del Norte Community Health Center also all over it. I don't think there's a smaller pediatric practice, maybe Klamath, but that's part of UHS. But does Redwood family practice take care of kids? I have no idea, actually. That would be nice to know. Redwood family practice, give us a call and we can put you in there. I don't think that they necessarily have this vaccine, though.
Because a family practice doesn't per force imply pediatrics, right? Those would be separate things. Because to me, just the term family, you got the kids.
There's strange rules in medicine.
Sure,
This might be one of those inconsistent, strange rules. But I also think that these vaccines require pretty complex refrigeration and freezers, and they're constantly monitored for appropriate temp and stuff. And I know that when the power goes off, they've got generators and stuff, so they take this all very seriously. And I'm not sure every small office would be able to meet those standards.
Right. Okay.
So public health department also, I just did a mass vax at Smith River on Sunday, actually. And I think we vaccinated about 15 people. They were not vaccinating kids at that time.
Right.
So the 5 to 11-year-old group was not vaccinated, although I saw a couple teenagers vaccinated. But they're going to start up in the next week or so.
Excellent. Okay. And then as far as the pharmacies go, are they all basically COVID capable here in town? I mean, Walgreens, Rite Aid, Walmart, where else?
Yeah.
Yeah. Okay.
Yeah. The only one that's used to be but isn't is Bimart, only because they're closing their pharmacy. So, yeah.
Excellent.
CVS.
And think about bundling if you're interested in getting vaccinated for the first time or getting a booster shot. And as far as boosters go, we haven't reached the sort of cattle call for everybody, right? We're still in the tiered.
Yeah, but remember we talked about that, and the tiers on first inspection look super restrictive. But they're not.
But they're not, because
really
they have
open. So a lot of people may meet criteria for things like based on weight, or because they have seasonal affect disorder when it rains, or maybe they smoked when they were in high school.
So
those are all criteria that'll get you that third jab.
And as far as, I mean, if you go for a booster shot, even though now we're supposedly in this sort of tiered rollout of the booster process, I mean, it's not like you're taking a test, right? It's pretty informal. You can go and say, yeah, I smoked in high school, or yeah, I'm 30 pounds overweight, or whatever. And I mean, it's not like
up here, the pharmacists don't really, or even the nurses in the clinics and stuff, they're all about shots in arms.
They don't care.
Yeah,
Come in and get
I
it.
had family members in the Bay Area and LA who were kind of grilled. And some of them turned away because the pharmacists kind of interpreted their risk factor incorrectly.
Okay.
But up here, I haven't heard anybody having any problem with that.
Good. Cool.
Yeah.
Did you have something? Okay.
Oh no, I'm just thinking about other things. I'm coming up with a musical.
What's your musical?
I know one of the songs are going to be "The Hills Are Alive" with the sound of Pfizer.
Yeah, it's going to be called Shots in Arms.
Shots in Arms.
Yeah.
I love that.
With everybody making a little heart sign.
That's right. Or we could have COVID warrior princesses dressed like Viking maidens.
Yeah,
The Valkyries coming in.
people are going to be asking for those tattoos.
That's wonderful.
We're on it.
Lynn, is there anything else we should talk about this week?
I want to talk about drugs next week.
Drugs? What kind of
Yeah.
drugs?
drugs that are used to treat acute COVID and how they arrived at what works and a little bit on what doesn't.
Wow. Okay. Excellent. Yeah.
Yeah, the Together clinical trials.
And there's a new pill coming out, a new antiviral pill. I mean, it's different from the one we talked about, right?
Yeah,
Isn't there another one?
Yeah, we're up to like 3 or 4 of them.
Right, yeah,
I think Pfizer's got one, right?
Pfizer's got one, Merck's got one. Whoever made Luvox, I mean, it's been generic for 20 years, probably.
Wow.
Oh, everyone's got a pill.
Well, and it's just the whole antiviral thing, because that's been something that hasn't really... it was difficult to treat. I remember this, maybe a generation ago. It's difficult to treat a virus. You just let it take its course. There's nothing we can really do about it. That's changing.
So the mid-90s with protease inhibitors for HIV, and it's simple, elegant medicine, and it was a paradigm. So, and then treating Hep B, chronic Hep B, treating Hep C. I mean, all of that right now, mind blown. We were able to extrapolate from what we figured out in the HIV realm, and so, we keep using that. All that stuff keeps getting.
Well, and that all follows along, like in the mRNA vaccines, then are in a direct sort of consequence of.
Right.
Of AIDS medicines, of HIV medicines in the 90s.
Yeah, we're building on what we learned.
That's science.
It's a paradigm. Amazing.
Lynn Szabo, thank you so very much for this week's Health Matters. I look forward to learning more about treating the heavy COVID next week.
I can't wait for the drugs.
For the drug show. It'll be a drug show next week. Lynn, thank you very much. We'll see you.
KFUG Community Radio, the right choice for family-friendly radio.